Right, we should be there now, somewhere close. Right, can you see that?
Yep.
Fantastic. Right, thank you for that lovely introduction, Matt. Welcome everybody. Hope you're having a really good afternoon. It's nearly bedtime for me, but the sun's still shining, so I hope it's the same for you guys. So I've been asked to just talk to you about one of the methods I use to master mycotoxin illness and why. So if I just give you an overview, I'm going to just tell you who I am. Just talk briefly about mycotoxin illness and what it is, how it presents, any conditions that are maybe associated with mycotoxin illness. Then I'll go through what to look for in a clinical history. And then there's nutrigenomic factors to consider as well, and testing. I'm going to do a little overview about binders, why we might need them, how to use them, any considerations when using binders, and a couple of myths and legends about them too that I've learned from my own clinical practice. I'm going to be discussing the detoxification of mycotoxins, and then I've got two really nice case studies from my practice, one of which is a young lady with inflammatory bowel disorder, and one is an acute on chronic mold exposure with genetic histamine polymorphisms following a near-death experience, which was probably one of the most interesting cases I've ever come across. So hopefully you'll enjoy those and they'll give you something to take away. So I'm basically a medical empath. I do a lot of things intuitively and then I test just to make sure. I was always that but why kid, always told to shut up. I was vertically challenged myself since the age of 3, and I had autoimmune disorders since the age of 6. And basically one side worked my way through health and psychology and then the functional medicine. I was just literally chasing my own biochemistry, became my own science experiment. But again, for me, the interest sparked after a near-death experience from a mold-induced mast cell activation disorder. So before that, I knew nothing really much about mold. It was only just coming onto our agenda in the UK. And so it hit me very quickly. My career spans a lot of years now. I was a cardiothoracic intensive care sister for about 25 years. Then I left, well, I started to burn out in that career, so I took on a nurse trainer's role, which was a UK-wide territory role for about 7 years, whilst I studied applied psychology. And I also have 2 children, well I say children, they're in their 30s now, 2 boys. The elder one has an autism diagnosis, high functioning autism. I think he's actually a savant. And the younger one, he does have very clear autistic traits, but he's much quieter than the older one. So he didn't get a diagnosis and we purposefully didn't chase one. So 2 boys with ASD, they've both done really well, so I'm very pleased. I started to learn nutrition really because of my elder boy, because he really struggled. And I studied that at the Institute of Optimum Nutrition in London. And then later I did my MSc at Middlesex. And after doing the functional medicine modules in 2011, I then ran the MSc in Nutrition Science and Practice in the Northern College of Acupuncture from 2010 to 2017. I've been teaching in higher education since about 2008. And between 2012 and 2018, I had another company called Gene Snippers, which used to go around the country teaching people how to interpret and work with nutrigenomics. And the passion for all of this, to be honest, was the need to fix my kid. And it just created a lifelong learner out of me. I'm a bit of a gadget queen. I use all kinds of things in my practice, really. I find loads of people are absolutely anxious, stressed out of the head. So I do a lot of heart math coaching. I use Ness Health quite a lot, because Ness Health helps us to see the emotion side of the illness, and how we can work with the energy field to help the biochemistry even more. I use live blood cell analysis as a way of just seeing how impaired the blood system is, you know, and what we can work with there. And I often use tuning fork therapy for those people who've had traumas. So yeah, to help move the energy body and move the traumas out. And for those who are really toxic, I often use the AMD ion cleanse as well. So I've got quite a lot of things in my toolbox. I'm very focused on cell membrane. I was very, very lucky to work with Dr. Patricia Kane from the States, and Dr. Damien Downing for about 7 years. So they taught me lots of things about the cell membrane. And of course, the cell danger response is Navo's work. So I'm really, really interested in all of that side. And the other thing, I try always to work with Klinghardt's model for healing. Klinghardt's a German physicist. He's probably one of the cleverest men I've ever met. And I love how he works, because he's very holistic. He talks about these 5 levels of healing that we have to achieve for the body to reach homeostasis and heal effectively. I mean, we just really look at the physical body mostly, and we don't appreciate all the other sides of it. And all this work that Klinghardt's done has really come from 12,000 years of Ayurveda, Chinese medicine, the old yogis in Himalayas, Tibet. So he's pulled a lot of work together. So what he talks about, these 5 levels, the level at the bottom, the physical body, it's all about structure, biochemistry. It's all the stuff we know and we deal with on a day-to-day basis. He then talks about the level above, the second level, which he calls the energy body. And the energy body is where we might use acupuncture or neural therapy, magnetic fields technology. It's all about feelings. Qigong could be used here as well. It's things affecting the nervous system. And then he talks about the mental body, and this is the instrument which Klinghardt believes we record all our life's events. We don't have any discernible evidence to say that there's a circuitry for long-term memory in the brain. So Klinghardt and others believe that this is all stored in the energy body, which in the mental body and the energy body. And the only way I could really describe the energy body, it's like, for those who understand aura, it's kind of just off the body. So he thinks that the memory is stored in biophoton fields outside the body, and they need to be organized and structured. And then at the 4th level, he talks about intuitive body. And this is more, it's more on a shamanic metaphysical field, really, but this is where things like family constellations works very well. Klinghardt talks about a lot of transgenerational trauma in this level, and he says we must heal the traumas of the past to gain full wellness. And he also talks about people with particularly autism spectrum disorders. He's talking about these people carrying the traumas of 4 generations. And he's saying that most of ill health is being explained by physics rather than purely by biochemistry. So I just like his way, really. And then the 5th level, which is the spiritual level, well, that's for the individual themselves to look at. It's the individual's responsibility. There isn't a practitioner practicing who can help you to heal spiritually. It's all up to you. But that's kind of just Klinghardt's model, just to kind of give you an idea of where I'm coming from. So let's look at mould, because that's what we're here for. So what is mould? Well, mould really is a non-scientific term for many types of fungi. And these can be unwanted, unappealing patches of black, brown, yellow, pink, green, smelly, fuzzy growths. There are countless species of mould, and they're found both indoors and outdoors. Mould and fungus have many connotations. Most of them seem very unpleasant. You see it in terms of musty odours, damp basements, mouldy carpets, water leaks, soggy drywall, athlete's foot, poisonous mushrooms, amongst others. But then on the positive side, moulds are also responsible for the creation of penicillin, blue cheese, yeasts are fungi, of course, and they're used to make bread, beer, wine, and some types of mushrooms are considered edible delicacies. So without fungi to break them down, the world would be buried in leaves, grass, trees, and garbage. So we have a lot to be thankful for mould and fungi at the end of the day. Although mould and its spores are literally everywhere, active mould growth requires moisture. Whether on the visible surfaces or hiding behind drywall, in attics or under carpets, indoor mould grows in the presence of excessive dampness or water. It's also found in damp indoor environments where bacteria, dust mites, and breakdown products of bacteria and mould, such as proteins, cell wall particles or glucans, and volatile organic compounds, like the actual cause of the musty odour associated with mould, airborne chemicals, gases, and particulate matter caused by the destruction of materials by growing moulds, well, they can all be there as well. So quite a lot to contend with there. So what about the health effects? Well, indoor mould can be unsightly and smelly, but the potential problems are more serious than that. By definition, actively growing mould damages the material it lives on, thereby impairing structural integrity. In addition, the mould is associated with some really untoward health effects in humans. These include things like allergies, infections, and some health effects attributed to mould might in fact be caused by bacteria or dust mites or similar. They're found in mould colonized environments, which we term toxic mould. And this has been claimed as a cause of toxic mould disease. And this syndrome remains undefined, and toxic mould as a cause remains unproven. Toxic mould is also unproven as a cause for the various symptoms associated with sick building syndrome, but it has been associated quite markedly. The mould growth in homes, schools, and businesses needs to be eliminated for the sake of human health, for structural integrity and for quality of life. Cleaning up small amounts of mould can be done by homeowners, but eliminating mould from large areas requires expertise and protection both for the removal specialists and the occupants of the affected space. So for mould to cause a problem, the most common occurrence is from inhalation of mould spores. It's not the sole source, and we'll come on to some other sources in a little while, but this particular source attacks the respiratory airways, causing bronchospasm. It can cause allergic asthma, allergic rhinitis, and the spores can be dead or alive and still cause a problem. So what's a mycotoxin? It's a secondary toxic metabolite created by fungal organisms that are capable of causing disease and death in humans and other animals. These guys inhibit protein synthesis, they damage macrophage systems, they inhibit particle clearance of the lung and increase sensitivity to bacterial toxins. These toxic compounds are naturally produced by moulds by certain types of molds, and molds that can produce mycotoxins can grow on numerous foodstuffs such as cereals, dried fruit, nuts and spices. Mold growth can occur either before harvest or after harvest, during storage on or in the food itself, often under warm, damp and humid conditions. We get a lot in wheat, certainly in the UK, because we're a bit of a damp country here, and the wheat just gets stored in huge vats that never really get turned over. So we see a lot there. Several hundred different mycotoxins have been identified, but the most commonly observed mycotoxins that present a concern to human health and livestock include things like aflatoxins, ochratoxin A, patulin, fumonisins, zearalenone, nivalenol, and mycotoxins appear in the food chain as a result of mold infection of crops both before and after harvest. So exposure to mycotoxins can therefore either happen directly by eating the infected food or indirectly from animals that are fed that contaminated feed, in particular milk toxins. So how can we minimise risk? We advise people really to inspect whole grains, especially grains like corn, sorghum, wheat and rice, because they seem to be the worst offenders. Dried figs and nuts such as peanuts, pistachios, almond, walnut, coconut, Brazil nuts and hazelnuts, because they're all regularly contaminated with aflatoxins. So we need to check those for evidence of mould, and discard any that look mouldy, discoloured, lighter in colour or shrivelled. Avoiding damage of grains before and during drying in storage, as damaged grain is more prone to invasion of moulds and therefore mycotoxin contamination. So you need to be aware that we need to buy our grains and nuts as fresh as possible. Make sure you buy them from a store that rapidly turns over their stock. Don't keep these foods for extended periods of time before being used, and always ensure a diverse diet, because this not only helps to reduce the mycotoxin exposure, but it also improves the nutrition and it improves the diversity of the microbiome, which will help in minimising risk and keeping the mycotoxins down. So what about mycotoxin illness, or CIRS as it's sometimes known? This is a chronic inflammatory response to the exposure of mold, and when a person is exposed to the biotoxins, they're not generally recognised by the immune system, so they don't get removed. So they can remain in the body indefinitely. And then what happens is these toxins can pass from cell to cell. In a person who's susceptible, they can have a number of exposures. And the case that I'll talk to you about today had a number of exposures in the 3 years prior to having the big exposure. So they're going to cause damage within the body, and particularly to the cell membranes. And then body-wide inflammation just creates even more cell danger response. So this is why Navo's paper is really important. So if you haven't read Navo's paper, I'd recommend you you use the link and pull it down and read it, because it's really interesting reading. So how does mycotoxin illness present? Recent insights have generated a really new perspective where there is a bidirectional relationship between the mycotoxins and the gut microbiota. So this suggests that our gut microbiota might be involved in the development of mycotoxicosis, and the interplay for the host is highlighted in this review article that I've given you the link for there. It's now well established that a healthy gut microbiota is largely responsible for the overall health of the host. The findings revealed that the gut microbiota is capable of eliminating mycotoxins from the host naturally, provided that the host is healthy with a balanced gut microbiota. Moreover, mycotoxins have been demonstrated for modulation of gut microbiota composition, and such alteration is in the microbiota can be observed up to species level in some of the studies. Some, if not all, of the reported effects are negative in terms of intestinal health, where beneficial bacteria are eliminated, accompanied by an increase of a gut pathogen. And that can be anything in addition to mold, because generally speaking, it's not on its own. So the chronic mycotoxicosis causes a greater impact on human health. It can induce diverse and powerful toxic effects. Some of the effects of it can be carcinogenic, mutagenic, tetragenic, estrogenic, hemorrhagic, immunotoxic, nephrotoxic. So basically, we're saying it just affects every organ, and it definitely affects the nervous system massively. So here are some of the symptoms that are affected by mycotoxin illness. Within the respiratory system, we get things like shortness of breath, sinus issues, wheezing. In the circulatory system, we get blood clotting abnormalities and elevated cholesterol. In the urinary system, we get increased thirst and urinary frequency, which can, of course, indicate diabetes. In the endocrine system, we get weight loss or weight gain. We get thyroid dysfunction, elevated blood sugar, low testosterone, and low adrenal function. In the immune system, we get development of various autoimmune conditions. We get reactivation of dormant viruses and other infections. In the neurologic system, we get a lot of numbness and tingling. People find it difficult to find words, so they lose words in sentences. We get a lot of visual changes, and to be honest, Patricia Kane uses the visual acuity test to test both for mold toxicity and for the state of the cell membranes, or the amount of phosphatidylcholine that is in the body available to help to reinitiate cell membrane replenishment. We also get tremor, fatigue, malaise, brain fog and seizures. So again, quite a marked change in the neurological system. In the psychiatric domains, we see things like depression, anxiety, concentration and memory problems. And then in the gastrointestinal, we get diarrhea, abdominal pain. Celiac disease can often occur as a result of mold toxicity. And then in the musculoskeletal system, we get things like weakness, joint problems, muscle aches and pains, and static shocks. So, you know, if you get all of those, that's not a good place to be. So with reference to the mycotoxin symptoms, or the CIRS, chronic inflammatory response syndrome, we've got 11 signs really. I'm sure this is not an exhaustive list, and so, you know, I've just taken the basic ones. So what have we got here? We've got brain fog and memory problems, trouble focusing, headaches, fatigue and weakness, unexplained muscle cramping, aches and pains in the joints, persistent nerve pain, numbness and tingling, eye problems, things like red eyes or light sensitivity, or visual field shutdown. I see quite a lot, visual acuity issues. We can get asthma and sinus problems like coughs or shortness of breath, tremors and vertigo, digestive systems. There's a whole range there, changes in appetite, diarrhea, nausea, abdominal pain. Often they come with a metallic taste in the mouth as well. We can get temperature dysregulation or night sweats. And so you can see the variety of symptoms are large, but they also overlap with other conditions. It's not always the food we eat, but it can be the air that we breathe that makes us sick. So some of the conditions, again, we're just having a review here. So neuropsychiatric conditions, cognitive impairments, musculoskeletal, autoimmunity, chronic and severe fatigue, multiple chemical sensitivity can come up as well, because of course there's going to be an impact on the liver, and then cancers. So quite a lot there as well. So assuming you've got a client that you might want to look for mold in this person, or you might suspect it, some of the things that you might want to look for in your clinical history that are not obvious: does the client feel better when they go on holiday? Because if they're living in a moldy home, then they go on holiday and they're out in the nice sunshine, they've gone somewhere nice, or they're in a brand spanking new hotel, then they might temporarily feel quite a lot better while they are away. And then as soon as they come back and they're in their own home and they're smelling the mold, it doesn't take many hours for them to start going back into decline. But then the reverse is also true. When they've not realised, but they've kept a very mold-free, dry, well-circulating home, and then they've gone away to a more moulder or damper place, then they could get sickness the other way around. And our client today, one of our clients today, is exactly that person. You could look at, does the client live in a particularly damp part of the country as well? Over in the UK, we are very damp because we're a small island, so we get a lot of mold problems here. You could ask if there are obvious mold spots or previous leaks in the home. These might not always be obvious. Sometimes these leaks are between stud partition walls, as we call them. So, you know, you could have a leak for years and not really realise it's there until you can smell the mould that's growing, or smell the rotting wood where the leak is. Sometimes they're behind sink units, particularly in kitchens. Also, you could ask them if there've been any renovations to the home, because of course if there has been mould and they weren't aware of it, and then they've done a renovation but not cleared the mould, well, the spores are all going to be released into the home, but then because the mould hasn't been identified and addressed, it's still going to be lingering as well. And then look at the diet and just say, is the client consuming lots of foods that might harbour mould? And we'll talk about some of those foods in a little while. I've got them on a later slide. So what about testing for mycotoxins? There's a number of ways to test. Armin Labs test with an early spot. You've got the tests at real-time laboratories. And then Great Plains do a urine test they call GPL Mycotox, which we tend to use in the UK because it's easier. Genova Diagnostics, they do IgE antibody testing. And then there's various companies, I'm sure you'll have the same across in the USA and Canada, where building forensics people come and do the testing. When we look at the testing, the early spot is said to be between 20 and 200 times more sensitive than a conventional ELISA test. And the GPL mycotoxin is urine, and this looks at 11 common and serious molds and gives levels in a graphical format with a good written report covering possible exposures and health risks of those identified molds. So in the UK, we tend to kind of home in on tests like that give us a lot of information, and I have got one to show you. So the sources of mold that I've literally come off the tests that we use. So the first one is aflatoxin M1, which comes from Aspergillus. We often see that in dried beans, corn, rice, tree nuts, wheat, milk, eggs and meat. This particular toxin can lead to liver damage, cancer, mental impairment, abdominal pain, hemorrhaging, coma and death. It's been shown to inhibit leukocyte proliferation, and some of the clinical signs of aflatoxicosis are non-pruritic macular rash, headache, gastrointestinal dysfunction, which is often very extreme, and lower extremity edema, anemia and jaundice. So quite a lot there that you could look for in your history that might give you some clues. The ochratoxin A, exposure to this again is primarily through contaminated foods such as cereals, grapes, dairy spices, juices, dried vine fruits. Exposure to this can also be from inhalation exposure in water damaged buildings, and this one can lead to kidney disease, adverse neurological effects, and studies have shown that ochratoxin A can lead to significant oxidative damage to multiple brain regions, and it's highly nephrotoxic too. Dopamine levels in the brains of mice have been shown to be decreased after exposure to ochratoxin A, and you'll see this in the case today as well. Some studies have hypothesized that ochratoxin might contribute to the development of neurodegenerative diseases such as Alzheimer's and Parkinson's. So again, quite a lot there with this one. The pterygomatocystin, this is considered to be quite carcinogenic, particularly if it lands in the cells of the GI tract. It's been found in the dust from damp carpets, and it's also a contaminant of many foods, including these, including grains, corn, bread, cheese, spices, coffee, soya beans, pistachio nuts, and animal feed. So other sources include zearalenone. This is produced by the Fusarium mold species and has been shown to be toxic to the kidneys, the liver, the immune system. It's genotoxic, and it's found on several foods, particularly in the United States, Europe, Asia, and Africa. The foods known to be contaminated include wheat, barley, rice, and maize. It has estrogenic activity, and the exposure to this can lead to reproductive changes. Estrogenic activity is higher than that of other non-steroidal azoflavone compounds that have any other estrogenic effects, such as soy and clover. Exposure can also result in thymus atrophy. It can alter spleen lymphocyte production as well as impair lymphocyte immune response. So that leads to patients being more susceptible to disease. Interestingly, this particular mold can be deactivated primarily through glucuronidation pathways. So individuals with impairments in this pathway might be more susceptible, but again, at least it gives you some ideas of what you can do to support that. The rhoridin, these are frequently found in buildings with water damage, but can also be found in contaminated grain again. This is a really toxic compound, and it inhibits protein biosynthesis. It's considered extremely toxic and has been used in biological warfare agents. Even low levels of exposure can cause severe neurological damage, immunosuppression, endocrine disruption, cardiovascular problems, and gastrointestinal distress. Quite a lot there as well. The verrucarin is produced by the Stachybotrys, Fusarium, and Myrothricium. It's frequently found in buildings with water damage, but again can be found in contaminated grain. It's a small amphipathic module that can move passively across cell membranes, and the primary tissues affected by it are intestinal and gastric mucosa, bone marrow, and spleen. It causes damage to human cells by inhibiting protein and DNA synthesis. It disrupts mitochondrial function. and it produces oxidative stress due to the generation of a lot of free radicals. So this can also cause immunological problems, vomiting, skin dermatitis and hemorrhagic lesions. So quite a lot going on there as well. And this final one is, this is one of the most common cereal contaminants, Eniatin B. Again, comes from the Fusarium mold. Grains in many countries have been recently contaminated with high levels of this particular mold, and the toxic events are caused by the inhibition of acetyl-CoA, cholesterol acetyltransferase, and depolarization of the mitochondria, and inhibition of osteoclastic bone resorption. This has antibiotic properties, and chronic exposure might lead to weight loss, fatigue, and liver disease. There are some nutrigenomic considerations here as well. There are certain polymorphisms that we know if they are expressing, then they can prevent the breakdown of histamine. So diamine oxidase, or DAO, is our first one. This is important for extracellular breakdown of histamine. Histamine N-methyltransferase, or HNMT, this is important for the intracellular breakdown of histamine. The aldehyde dehydrogenase, or ALDH, this breaks down alcohol and aldehydes, so toxins from yeast and mold, technically speaking, or they can be made by aberrant gut bacteria. Undermethylators can also be histodelic, and histamine reduces levels of phosphatidylcholine because it absolutely batters phosphatidylcholine. And if you're not making enough phosphatidylcholine to start with because your methylation is poor, then histamine will just absolutely trash the cell membrane. So it's really important to have a handle on this particular mechanism, because once mold is in the system, it will stop the breakdown of histamine if these SNPs are all expressing. However, conversely, phosphatidylcholine is an antihistamine, so for that reason, methylation needs to be kept optimal. So what about one of the approaches to eliminating mold? We could use binders. And binders are kind of used as a sponge to soak up the toxin load. In an ideal world, certainly in the UK, we tend to just use gut-only binders, because this seems to be safer than nanoparticle binders, and I'll just talk a little bit about them in a while. So we're just going to go through why use a binder, what are the considerations for the use of them, a few myths and legends, and then how I might use them in clinical practice. The first one I use is a product called Cliniptilolite. There's lots of research around Cliniptilolite. It's a natural volcanic zeolite. It's gone through 2 processes for cleansing, and it ends up as a microporous aluminosilicate, which works with various cations. It forms where volcanic rock and ash layers meet, so there's alkaline water there, but of course because it generates itself there, that's obviously a dirty area, and because of the nature of what it does, that it absorbs, it's going to absorb everything that is a toxin in the area, and this is why it has to go through an extensive process of being cleaned, or this 2-part cleansing process. We use it quite a lot to help the leaky gut heal as well. There tends to be quite a bit of misinformation when it comes to the use of binders. The Cliniptilolite definitely seems to be classed quite readily with other binders such as bentonite clay, pyrophyllite clay, activated charcoal. It's associated less with products such as Takesumi and the C60 hardwood charcoals and chlorella. And the issue seems to be that a lot of people believe that all these binders will mop up minerals. What I've noticed in clinical practice is, yes, the vast majority, things like bentonite clay, activated charcoal, of course they do, because they mop everything up in sight, which is why they're really good for an immediate reaction to a food allergy or something that's been ingested that shouldn't be in the body. And I wouldn't hesitate to use charcoal in that situation. I wouldn't necessarily use it long term in anyone with a mold problem. If we need it for a short term, I wouldn't use it for more than between 3 and 5 days maximum. I try and just put 1 or 2 doses in and leave it at that, because it does mop up minerals. But what I found with the Cliniptilolite is, I think it leaves minerals alone. And the reason I say that is because a lot of my clients who've had mold problems, what they've reported is, because the body's quite acidic when it's full of mold, they get a lot of symptoms like leg cramping at night time, particularly at night time. They get to bed and their legs are cramping so bad it's keeping them awake all night. And no amount of extra minerals can really sort that out. So you would be just throwing minerals at them, which doesn't make ethical sense. But when you put Cliniptilolite in, within 24 hours, if you use a really good, if you use like the leaky gut protocol, which is 6 capsules, 2 before each meal, an hour before each meal, and then a powder last thing at night on an empty stomach, then within 24 hours, all those cramping muscles, they all seem to disappear. And when you stop the Cliniptilolite, those symptoms will return within 2 days. So it's quite, and I've done this a few times now. So that's why I tend to go for that product more than anything. Cliniptilolite is known to absorb things like histamine, and there's quite a lot of research behind it now. It absorbs ammonium, it'll absorb heavy metals such as lead and mercury, light metal, aluminium, cesium, arsenic and mold. So I absolutely love it for that reason. I get a lot of really good results with it. When it comes to the detoxification of the mycotoxins, before you do anything, we need the channels of elimination open. The bowels have to be working 1 or 2 a day. The kidneys have to be functioning well. The liver, the gallbladder has to be clean, and the lymphatic system has to be working. Otherwise, all the toxicity is just going to keep recycling, because of course the colon reabsorbs 95% back into the hepatobiliary system. The toxins from the gut, they're going to leak into the gut-associated lymphoid tissue and then into the general lymphatics, which then creates stagnation. And when you've got that kind of toxic overload, you've got all these conditions that go with it. And I find if you use something that binds actually in the gut, what we get is we get a steady detoxification. So we're not pushing the biochemistry too far one way or the other. Because detoxification is always impaired in this particular scenario. So we've just got to go really slowly. So I find once we clear the gut, then the gut-associated lymphoid tissue will be able to start to release the toxins into the gut, and then we can mop that up, and then we can get the person to maybe do some rebounding, or we could use something like mangister as a herbal remedy to move the lymphatics. But I always work from that perspective. So let's have a look at the cases that I've got for you today. The first one, as I said, is a lady with inflammatory bowel disease. So this lady's 45 years old. She's married with 2 children, aged 6 and 9, both girls. She's self-employed and she works from home. And she presented to me with overwhelming fatigue over a period of 3 years. She'd moved into a new apartment at that time, and she was housebound by the time I saw her. I actually missed this one, which is why I've put it in. I missed the mould completely because, as I said before, until I'd had a mould problem myself, I just wasn't switched on to this at all. And it was very new in the UK. I know in the US you've known about it for years, but we hadn't. So this lady's housebound. She's got a lot of bowel inflammation. She's had that the same length of time. She's had various investigations, barium swallows, barium enemas. She had a test for celiac disease, and everything came back, nothing abnormal detected. We did a stool test. She had a mild yeast overgrowth, and she had mild blastocystis homini. We didn't find anything else in that stool test. So because I didn't know about the mould, we set off following a standard gut restoration approach, which we call the 4 R's in the UK. And I gave her some adrenal support to try and lift her a little bit, give her some reserve to try and clear her gut up without compromising her. We compromised quite slowly with some slippery elm, some probiotics and some Swedish bitters, just to get the digestion going again, to try and get the leaky gut to start to heal up a little bit, and the probiotics to quell the inflammation. Couldn't do anything more than that because she just reacted to everything. So she reacted She reacted to all the supplements, which caused a worsening of her fatigue and even more bowel inflammation. And at this point, she was waiting for an endoscopy, which went ahead. She was found to have mold infiltration in the large bowel. And at this point, I commenced Cliniptilolite with her on the leaky gut protocol, which, as I've said, is 6 capsules, 2 before each meal, and a powder lasting at night. I think it's really important to make the note that this needs to be given at least an hour before food, because once the food is in the gut and the fats and the proteins are stimulating the release of digestive juices and bile, then once the bile is flowing, the toxins are going to come out through the liver. So you need something to bind it up at that point in time. So I always give this an hour before. So 4 days later, she was up and about, going outside and feeling much better. So at this point, we were able to go back to the 4 R's approach, which basically for us is removing the toxins, replacing the digestive juices with hydrochloric acid or betaine hydrochloric acid and digestive enzymes, and bicarbonate if that's appropriate. We rebalance the microbiome, and then we restore gut integrity. The order depends on individual patient presentation. Sometimes you do them all at once. Sometimes you do a little bit of gut healing first so that they don't react when you give them the antifungal herbal remedies. But it just depends on the individual person. So for this lady, we gave her the adrenal adaptogen, and we gave her 2 daily. We gave her the Cliniptilolite on the leaky gut protocol. I also gave her some broccoli seed extract in a drink twice a day. And the reason I gave her that is because I normally would use DIM, diindolylmethane, but it's banned in the UK. So we have difficulty getting hold of it. We can get it, but it's not easy. And we contravene our professional guidelines if we give it. So broccoli seed extract seemed to work for her. I gave her probiotics, which had a really high bifido count. And I gave her a product called Oregano Complex twice daily. Oregano Complex is made from essential oils, and they're dried, and it's got a number of small dosed herbals in it. So it's got oregano, cinnamon, garlic, and a couple of other bits and pieces in it. So it's a really nice product, and I usually go for that because rather than throw a high dose of one thing in it and risk not rebalancing the microbiome, I try to go for things that are food based, because we know from, we had a really lovely study last January, so January 2019, done by one of our professional body people, who looked at microbiome diversity through a variety of stool tests and worked out that the body needs 50 different types of vegetables over the course of the week to be able to create microbiome diversity. Now that's very difficult for us in the UK, particularly right now. And so if I can use herbs and other things to actually make up the 50 food groups, the 50 vegetable groups, then I'm happy with that. We also gave this lady bone broths, which she tolerated quite well. And after 3 months, she was back at work full time. What we found was, I didn't see the mold. I saw this lady on Skype because she's not in my area. And what transpired was, when she did her own homework, her apartment was in the top of an old church. The old church had been renovated. She was in a beautiful apartment, but they hadn't replaced the roof. And so there was leaks in the roof, and it was all above her bed. So once they isolated where the mold was coming from, and the company who'd done all the renovations came back and did that, she was much better. She had some mild digestive symptoms that were intermittent, wind and bloating. And then we found that to be isolated to inadvertent corn digestion. So she was eating something that had corn in it and she wasn't aware of it. So once we got her off that, she started to do really well. At the 6 months follow-up, she was fully functioning with full resolution of intestinal hyperpermeability. She was full of energy. Her mood was back up at 10 out of 10. Her digestion, she measured at 10 out of 10. And the supplements I left her with, I recommended for 6 months to a year, just to top her immune system up and keep her steady. I recommended her just a liquid multivitamin and mineral, primarily because when the gut's been impaired to this degree, I like to go for either liquid multis or transdermal products so that we actually get it into the system. And then I recommended her just one Cliniptilolite powder at night time, just for long-term use. And as far as I know, she's doing really, really well. So that's a nice, simple case. Nice that our NHS doctors picked her up, bless her heart. So this one's a more complicated case. This case has got long-standing fatigue and histamine intolerance. So this is a female aged 50. Her history is she was a cesarean section and bottle fed, so she's already compromised in terms of microbiome diversity. She's married with 2 adult daughters. She's an accident and emergency nurse, postmenopausal. She's had various yeast infections in all orifices from the ages of 14 to 34. She was plagued with it. She had symptoms of estrogen dominance between the ages of 22 and 50, so lots of heavy menstrual bleeding, cramps, PMS, just feeling absolutely wiped out after a period. And then she was diagnosed with celiac disease at the age of 44, and then chronic fatigue at the age of 46. So when she presented to me, she'd had 3 mold insults during the previous 3 years. And she'd recently been to the United States, to Seattle. She'd stayed in a hotel that was moldy. She smelt the mold, so she knew it was moldy. And on the return flight, she was really unfortunate. The story goes that she ordered a gluten-free meal, but there wasn't one. And the meal they gave her was actually on a plate, not in the plastic, what do they call it? You know, in the proper airline packaging. She believes there was something on the salad. She just took 1 mouthful of lettuce and she immediately had anaphylaxis. And we think that it was high fructose corn syrup that was on that salad, because she definitely said there was a sweet taste. Luckily for her, there was a doctor on flight, and he helped her to get her back home. She was unwell on arrival home. She went to her own A&E and got checked out, but they sent her home because she looked fairly okay. She certainly wasn't ill enough to be put into hospital. She bumbled around for a week. One day she'd be feeling okay, the next day she would be feeling absolutely flawed and she'd be on a bed all day. But she didn't think anything more other than it was the mold exposure, and she just needed to literally dry out, as she said to me. She'd been through it before. She knew what the mold did to her. Didn't really appreciate how dangerous it could be, I don't think. So 5 days later, she collapsed and she was diagnosed with mold-induced pneumonia. She was given 4 lots of antibiotics, because over here we follow something called the NICE guidelines, and it's very protocol driven is our medical care. So 4 lots of antibiotics, which are obviously mold as well. There was absolutely no improvement whatsoever. Her symptoms were she was unable to tolerate food to the extreme. She had inflammation from mouth to anus, and she scored it at 10 out of 10. She had vomiting and diarrhea, which she scored 9 out of 10. She had whole body pain in the nerves and the muscles, which she scored at 7 out of 10. She had weight loss of 2 stone in 3 weeks. She had brain exhaustion, which again she scored 10 out of 10, and body exhaustion, which again she scored 10 out of 10, so not in a really great place. She had a lot of single nucleotide polymorphisms, and as I said earlier, we have to be really careful that we can actually break down the histamine, because of course the high fructose corn syrup had set off that anaphylaxis, which now looks like it was mast cell activation disorder. So here we've got some we've got HNMT that's expressing as homozygous. We've got a homozygous DAO. We've got a homozygous MAO-B, and we've got a heterozygous ALDH2. So once those are blocked with the mold, there's very little chance of breaking down histamine for her. And of course, high fructose corn syrup is the highest histamine food, and it's also coming from a moldy grain. So not a great place to be for this poor lady. We had some neurotransmitter tests as well. Because of all the problems she was reporting with her brain, I thought this was the safest thing to do. So, and we know that histamine absolutely floors the levels of all the other neurotransmitters. So you can see here, low dopamine, low norepinephrine, low serotonin, low taurine. So, you know, the gallbladder's not working, the neurotransmitters are not being made. She's probably really struggling with her methylation at this point of time. Her whole blood histamine came back normal, but then it probably would at this stage because she had the insult on the plane. And her tryptase was almost normal. It was slightly elevated, but nothing that you could say was mast cell activation disorder. So we had to really just go on clinical history with this lady. We did some Nutrival investigations as well, and we found methylhistidine was sky high, which might give us some clues to the histamine, and the ethanolamine and the phosphatidyl ethanolamine were extremely low, so she had a total lack of available nutrients to make new cell membranes. So here she was with histamine completely breaking through her cell membranes and no substrates to make some more. So the initial plan here was to work with Dr. Kane and Dr. Downing, because although I can give intravenous fluids and medications, they have to be scripted by a doctor in the UK for me to do this. So what we did was she had some intravenous. She had 4 intravenous, what we call phospholipid exchanges, which include phosphatidylcholine, phenylbutyrate, hydroxy B12 and methylfolate, and they all go in IV. So she had 4 of those. The beauty of that therapy is it just cleans the cell membranes and allows the phosphatidylcholine to get right into the cell membranes and start to do the repair. She also had oral phosphatidylcholine with a product called Body Bio Balanced Oil. These are all made by Body Bio, which is available in the US. They're my favourite company for this kind of thing. So she had those orally as well. To try and soothe the gut lining, obviously the PC is going to help that massively, and it did. She noticed within the first mouthful that that it was working. The Cliniptilolite we gave at 6 capsules, and we gave her 2 powders because we needed a powder in the morning as well, just to make sure we were mopping everything up. The nighttime powder really is there for when the liver is doing its cleansing in the early hours of the morning. As soon as you stimulate it in the morning, the powder's there waiting to help to mop up. But also it's there for the DAO enzyme, because the powder works mostly in the gut, upper gut, stomach, duodenum, and the capsules, they work more in the lower gut. So it's useful to have both. She also had 20 mils of phosphatidylcholine liquid with 20 mils of Body Bio Balanced Oil twice daily. And then we alkalized to support cell membranes. So we use things like liquid minerals and Body Bio's electrolytes as well, which is, I think it's Elite it's called. So symptoms after 1 month. Her inflammation came right down from 10 out of 10 to 4 out of 10. So she was more able to tolerate simple foods. We didn't put anything spicy or anything of that nature back in. We used a lot of khichdi for her, which is an Ayurvedic recipe containing beans and white rice. And of course, of course, brown rice would have been better for her blood sugar, but it's also full of phytates and lectins. And so with a gut that's this inflamed, I didn't want to risk that. So yeah, the mung bean, it's like a mung bean soup. It's really good for getting the digestion going again and detoxifying. Vomiting had come down. She'd no vomiting at all, and a diarrhea had come down to a 6 out of 10. So even though she had fairly liquid stools, she was only going once or twice a day, which was so much better. Whole body pain was reducing. We got that down to 4 out of 10 within the first month. Weight loss was static at 2 stones. And if you remember, she'd lost that in the first 3 weeks. Brain exhaustion was still a major problem at 9 out of 10, and body exhaustion was still a major problem. These were her live blood cell analysis, pre and post the intravenous phosphatidylcholine, which I think is absolutely amazing. So the one on the left was prior to us giving her 1 intravenous infusion. And you can see there's lots of aggregation of cells. So there can't be any oxygen getting around there. She can't be carrying iron round or B12 to methylate. She's got a lot of cellular toxicity. She's got a lot of serum toxicity, and the whole thing just looks like pea soup. So we gave her a 20-minute infusion, and after that you can see the cells are much more open and singular. They're much more mobile. There is a little bit of roulade, which is these stacked coin things here, and they say to us that she's low on digestive enzymes. She's probably on got low stomach acid, but the terrain itself looks much cleaner when you compare this to this. So you know, we can see that already we're getting some good results with her. So stage 2 with her was to look at her gallbladder. We continued with the oils and minerals and electrolytes. And to help her gallbladder, we gave her nano-emulsified bitters, which help digestive biliary support. I'm a big advocate for the nano-emulsified things at the moment, because they seem to just go into the system much quicker. We also gave this lady nano-emulsified DIM, which helps the gallbladder to release the toxicity. And it also is an NRF2 upregulator, so we can get a bit more energy from that. And interestingly, this lady noticed from the first mouthful of dim, or first 2 squirts, that she immediately felt better. So getting her off the dim was a bigger problem than giving her it. We continued with all the Toxaprevent, but with her, because she was so ill, what we found was she wasn't, I don't want to say she wasn't compliant. I think because she was sleeping an awful lot, she was missing some of the times when she should have taken a Cliniptilolite. And so a daytime dosing wasn't exactly an hour before a dim and a food. And if you're stimulating the gallbladder particularly, and then you're eating food, you absolutely must have your binders in the gut. So she wasn't feeling as well as she could be. So a little bit of tweaking with that gave us some good inroads to her. And so at 3 months, we were looking at the inflammation from the mouth to the anus came right down to 1 out of 10. No more vomiting. Diarrhea was 6 out of 10 still, so still a bit of an issue. But then she was excreting lots of toxins. The body pain came down to 2 out of 10. Weight loss static. Brain exhaustion was starting to clear, so we had a 5 out of 10 for that. And then the body exhaustion, again, had come down to 5 out of 10, so halfway. At this point, she reported a new symptom, which was the fact that she felt like she was walking in treacle. And presumably this is because she's actually starting to walk around again, and the lymph is stagnant, which we talked about a little bit earlier. So this is when we started to look at lymph cleansing. So we continued with the oils, the body bio oils, but we added ghee to the early morning doses. Ghee stimulates the gut-associated lymphoid tissue, and it stimulates the gallbladder to release more toxicity or more bile. And we combined that with a modified Colorado cleanse. And Colorado cleanse is John Dwillard's work. He's an Ayurvedic practitioner and a chiropractor. And he has this thing called Colorado cleanse, which uses kitchery, which helps, and you eat the kitchery 3 times a day, and that helps to reset digestion and clean up the lymph. She was quite happy to do this. It was supposed to be a 15-day cleanse, and she ended up doing it for 52 days. It's very nutrient dense, so you're quite safe to do that. And she did, and had some really good results. We continued the Cliniptilolite 1 hour before meals and kept her on the 2 powders. And at this point, we added in Manjista tea. Manjista, or red root tincture, is a lymph cleanser, a detoxifier, and a mild antimicrobial. Massively helps skin, massively helps lymph. So this was just an easy addition for her. So another 2 months after that, so symptoms at 5 months. Her inflammation had completely gone down in the gut. Vomiting had gone completely. Diarrhea was now 1 out of 10. So she was having the odd diarrhea incident maybe every couple of days, and it was just once in the morning. So whether we call that diarrhea, it's not. It's just loose stool, and it's just the body. I would just say it's the body evacuating. All her body pain had gone. Weight loss is still static. She hasn't put weight on yet. Brain exhaustion is down to 4 out of 10, and body exhaustion is down to 2 out of 10. And the walking in treacle situation has just about gone. So what we did here was we looked at what could this possibly be thyroid, because bearing in mind she had really low dopamine, and thyroid, dopamine, they're all interconnected. So this is what we found on the thyroid test. We found a really low total thyroxine. We found a really low free T3, but yet her thyroid stimulating hormone was normal. No globulins, no peroxidases, so autoimmunity side was fine. So this led me to believe that this was all dopamine led. And when we looked at her neurotransmitter SNPs, she had quite a lot here. So she's got COMT that is homozygous. And so that's obviously having a an impact here. She's got a slow comp, so she should be slow to break down dopamine, which means because the dopamine is low, she's clearly not making enough via the methylation cycle due to the toxicity from the mold. So we needed to improve dopamine pathway synthesis to increase brain energy and brain function. So phase 4 of her program was to continue with the oils, but to reduce them to a maintenance of 10 mils, because I felt cell membranes were doing okay now. Toxicity was down markedly. We gave her a dopamine pathway adaptogen for 3 weeks, just because it was it had a really broad base. But she was taking 12 to 18 capsules a day, and we were getting this from the United States. So it was costing twice as much as it would for you guys over there. And it just became really cumbersome in terms of cost. So what we did then was we looked at the specific amino acids she needed. I use a thing we call Lombard's quiz. There's Lombard did some really good work over here, or did some really good teaching over here on neurotransmitters a few years ago, and he left us with this quiz, which is basically all the neurotransmitters and then the symptoms associated, and the patients just tick them off. And then I look at that and say, okay, where are we? Because obviously we don't want to be spending hundreds and hundreds of pounds on yet another neurotransmitter test when she's just done that one. So based on that, based on the symptoms and the neurotransmitter test that we'd already had, I gave her L-tyrosine, 3 grams a day, which we split into 3 doses, and I gave her 5-HTP at night time, 300 milligrams, to help her sleep, help her get off. And we gave her mucuna purines, 5 grams of powder daily. And at 6 months, we were seeing really significant results. So again, inflammation had already gone down, vomiting and diarrhea completely gone, whole body pain had gone last time, weight loss was still static, so we still need to work on getting her weight up now. Brain exhaustion, body exhaustion, walking in treacle completely gone, so all symptom free at 6 months. We just had to work on improving her weight. So that was hopefully that was a nice whistle stop tour for you, and I hope that's been really helpful. Hope the cases were inspiring for you. If you want copies of the PDFs of the slides, you are welcome to those. I will give them to Matt to pass on. And I just want to say thank you so much for being here and for listening. And if there's any questions, shall I go to the questions now? Is that the best thing to do, Matt?
Yeah, it's probably the best thing to do right now, is going through the questions right now. It looks like there's some questions in the Q&A, and then there's some in the chat as well.
Okay, so I've got the questions in the Q&A on the subject of energy. Do you see a role for PEMF and biocharger therapy? To be honest, yeah, I love the My Health. I often use that based on whatever the scan gives us, or wherever there are blockages in energy that are giving pain anywhere in the body. So absolutely, Kevin, yes. Kathy's asking, is there a brand of Cliniptilolite available in the US that you can trust and recommend? I believe, I don't know if anyone's familiar with Sean Bean and Dr. Jess Armine. I believe they use this Cliniptilolite. The brand name for it is Toxaprevent, and I believe they're importing it from the UK. I don't know if it's available in the US. I couldn't tell you, so I'm sorry about that. But I do know they're using it. Where else am I going now?
Can you see the chat at all?
I'm just looking for it. Somebody's asking, will we be able to rewatch this talk later?
The answer to that is yes. We will be, we are recording this right now, and I will be placing, probably it'll take a day or two for us to get it up on the website, but it'll show up on the website after I give it to my IT people.
Okay. Somebody's asking for the slides or a video. Yes, I will give the slides to Matt, and you can have them with pleasure, not a problem. I'm just looking for the chat box and I can't find it, Matt.
I'll read them up. So,
here we go. I've got it. No problem. I've got
one thing that somebody asked was about real-time results and case studies. For that, I would recommend going to our video library. One of the more recent talks we had was from Dr. Alfred Johnson. I would rewatch that one if you want to see case studies with real-time results. That's probably one of the more recent ones we've had.
Okay, thank you for that, Matt. Can you inherit mycotoxins from IVIG infusion? Do you know, I'm not sure is the answer to that, Mary. I can go and find out for you. And yes, you can get aflatoxin from tree nuts stored in water, absolutely. You also get it from them if the storage is, I don't want to say poor, because nuts only come into our country once a year. I don't know how it works in the United States, but our nuts come in the winter around Christmas, and then that's the only time they come back in. So, you know, unless ours are stored well, by the time it gets to March, April, they're not looking particularly good. Can you use broccoli sprouts for the sulforaphane in lieu of DIM? Yes, I believe you can, Harlan. That's what I did with the first lady. Granted, she wasn't as sick as the second lady. But broccoli sprouts, they convert to DIM eventually. So yeah, I think in an easy case, absolutely. Oh, thank you, Kerry. That's nice. BPC 157 would have helped to decrease inflammation, and quercetin will decrease histamine. Thank you, Harlan. Fantastic. I'm not familiar with BPC 157, but I will have a look at it. So thank you. Where can you get Cliniptilolite? The brand name is called Toxaprevent. I don't know who's importing it to the US, but I think if you get hold of Sean Bean, I'm sure he will tell you, because he is definitely using it. Yeah, love a copy of the slides. What are your thoughts?
Everybody that wants a copy of the slides, just feel free to email Dr. Pratt Hyland, which is myself. I keep talking to myself in the third person, but just email me, and I'll have a PDF of all the slides. Ms. Ann, you already sent me the slides, so I can easily convert them to PDFs.
Fantastic, thank you, Matt. And the final question that I've got here is, I've been diagnosed with celiac. Is it likely that my mold invasion came from food and not from inhalation? Well, quite possibly, Carolyn, I would say. Judging by where all the molds come from in those particular tests that I've gone through today, I would say without a doubt. It depends where you live and where your food's coming from. Obviously, some areas are more mold prone than others, but certainly, you know, the grains and the dried fruits and all of those nuts, they're all prone to that. So yeah, hope that's answered your question.
I think we have one more that just came in.
Yeah, can't get through. My client can't get through the day without Gaviscon advances from the UK. It's the only thing that helps her with a histamine problem. She's used many binders, but still has mold. Undermethylated obese. I will use your program. What do you think of Gaviscon? I'm not averse to any medication at all, if I'm honest, Christine. If it helps in the short term, fantastic. I don't like anything that reduces stomach acid, for the simple reason it's going to reduce B12 if you're using it for a long term. And then that prevents you from methylating as well as you could. And with these kind of situations, they do need to methylate. There are a number of products that biotics research particularly make that help to, if the Gaviscon is because they've got reflux, then I would be looking at that and saying, is that because stomach acid is low, not high? And is Gaviscon actually not the right thing? But appreciate that it's one of those products that it's going to quell the symptoms and you can work with the patient better. So, you know, it is horses for courses here. I would look at products that biotics research particularly do some really nice ones that can help patients get off PPIs, Gaviscon, or silent reflux. Absolutely. So I would say with the silent reflux, look at the digestive juices and check whether she's got SIBO, because both of those can cause silent reflux. Also look at lower esophageal sphincter, because if she's got low stomach acid, the lower esophageal sphincter is going to remain closed. It's going to remain open, sorry, because it closes in response to the stomach acid acting on the food so that we don't get reflux. But if there is low stomach acid, that's going to remain open, and silent reflux tends to be reflux that occurs at night when they're laying horizontal. So it's going up through that lower esophageal sphincter. So absolutely. Harlan's asking about, would we use sodium bicarb to prevent reflux? I might use a small amount in some patients, but I'm very careful not to use that around meal time, because if you give them sodium bicarbonate, you're then alkalizing the stomach, and if it's already alkalizing itself because it hasn't got enough stomach acid, yes, it might sort the symptoms out, but in the long term, it's creating a bigger problem. What I tend to do is try and heal the esophagus and heal the guts. And I often use phosphatidylcholine for that because it's really quick to work. It goes straight in. If you use the liquid rather than the capsules, you get some really good resolution within 2 or 3 weeks. Or things like deglycerized licorice work really well, slippery elm works really well. Anything like that will help the reflux. So I hope that helps. Carolyn, will the celiac heal if I recover from mold toxicity? Once you've got a true celiac diagnosis, the medical profession would say that doesn't heal. I can only speak from personal experience because I've not seen it happen with any other patient, but my son was diagnosed as celiac at the age of 10, the one that has the diagnosis of autism spectrum. I haven't had him tested since, but he happily eats wheat and gluten now. He doesn't have it regularly in his diet because I still do the cooking. But he travels abroad. He's got friends in all kinds of places, and I know darn well when he goes out to meet his friends, he's eating pizza. So he does cope with it, and he doesn't seem to have any adverse effects. So I'm keeping my fingers crossed at the moment, because this has only been, well, it's probably been about 18 months actually before we went into lockdown. And he does do okay. So I think in some people, if they heal well, maybe they can tolerate a bit of it. The general rule is saying not, it doesn't heal.
Hey, Anne, I can give a little bit of insight into that. So in the past, I've consulted with a lot of different cases that have done food sensitivity tests with their patients. And one of the things I frequently see of mold patients is they form sensitivities towards lots of different foods. But for a lot of them, I've seen over time, after we've removed the mycotoxins out of the system, their sensitivities go down considerably. So I haven't quantified it yet, but I could say at least several dozen patients I've seen that phenomenon.
Yeah, I think, and I've seen that as well, but I'm just concerned, is this a definite celiac diagnosis?
Yeah, that's always
quite different, isn't it?
Yeah. I don't know if like true celiac it can get fixed, but you see a lot of people.
You do.
Wheat, dairy, eggs are some of the more common sensitivities you'll see at first from mold exposure. And I see it a lot where people have no sensitivities, and then they'll form those ones first from mold exposure.
Absolutely, yeah. And I see the same pattern, absolutely.
I think that's all the questions we had. Want to thank Anne again for coming to speak to all of us, and I also want to thank all the attendees for attending.
Yeah, thank you very much, everyone. Bless you.
Okay, I'll see everybody later. Bye.
Thank you. Thank you.